Hello, everyone. Welcome to the Reborn ICI Policy Forum. We are going to talk about some recent findings from a study conducted by ICI and NADSP related to DSP wages and racial disparities in those wages. We have Amy Hewitt, who will be talking through some of the results. We also have Joe Macbeth from NADSP, who will be with us for the first hour and may chime in if she feels like it. After that, we're hoping to have a discussion around sort of some of the issues that we presented. And we have some questions we'd like to pose to you as the audience. Before we get into it though, just a short introduction. I'm Julie Bershadsky, Director of Community Living and Employment Focused Area here at ICI. I've been in this role for about 5 months now, so I'm still finding my footing a little bit. Just a housekeeping note, this session is going to be recorded. We're hoping that it's going to generate some ideas at the end. So if anybody does not want to be recorded, please let us know, though I'm not sure what we'll actually be able to do about it. All right. Before we get into the actual findings, just a little bit about the sort of the history and the vision for the policy research briefs and these policy forums that we're going to be holding. ICI used to produce policy research briefs, or PRBs, as we call them, for many years. There have been multiple issues on various topics. Very obviously useful publications that did share one common thing, and that was that they were not very brief. So we sort of we're trying to rethink how we're presenting, how we're using this particular method of communicating results, and try to focus them, make them very short, make them accessible. The policy forums that used to be held were used to accompany the policy research briefs, but they were held in person. They were local in Minnesota. So we're restarting both the actual PRBs and the policy forums after about a break of about 3 years. And we, I'll talk about sort of the vision for these in a little bit, but we are revamping both. And in order to revamp them and sort of figure out how to do it, consulted with policy advocates who helped with the vision, right? And the idea is to take relevant data and discuss application to current policy, but have it be in a short, accessible format that would meet the needs of advocates and policymakers as well. The vision for the brief itself is for it to be very short, and I mean very short, like 2 pages literally, very focused, very accessible, and in a word, brief. We want to get to a place where the briefs can be created sort of on demand with a 2-3 week turnaround. And conceptually, we're looking at them sort of a bridge to the outside, non-academic, non-IDD specific world to other broader issues, to connect the IDD world, the service system, research questions that we're dealing with, to sort of the broader system, the broader world. We sort of conceptually, we need this because as we know, and as it has been painfully illustrated, the IDD service system does not exist in a vacuum. It exists within the larger delivery system, larger service system, and within broader society. As we know, there are issues within those larger systems and within broader society that we need to connect to. We can't fix issues in the IDD system without tackling broader issues. So the goal of the policy forum specifically is to present the PRB, the policy research brief, and have a facilitated discussion around the issues presented, sort of like a brainstorm session with stakeholders, advocates, and researchers. We're hoping that the policy forum can produce ideas and sort of result in a short further thoughts type publication if it's successful. So with that in mind, since this is the first one of the new policy forums, we would like to know who's on today. Future events will ask people to register, so we have an idea of who is who and how many people are on ahead of time. But because we're kind of winging this one, and we did not have registration, we just like to get an idea of who's on today. So we have a poll that pops up, and Nick, if you could pop that up. This will just ask you to select your primary role as it relates to disabilities. And you can select more than one. Sounds great, even better. There's still a few folks who haven't answered. All right, well, we have about half of you who are researchers, half of you who are family members of a person with disability, 3 people who are with an advocacy organization, agency, 3 people who are direct support professionals, and 2 self-advocates on. Oh, and we do have 1 person from a state or federal agency. All right, thank you for doing that. And with that sort of short intro, we'll launch into the actual results and the actual policy research brief. So this is what the recent issue, the last issue of the PRB looks like. Literally 2 pages. This is the front and the back. Very short, very simple, very accessible, very focused. And this is going to be the format more or less going forward, just a 2-page front and back presentation. We'll walk through each section of the PRB and then ask researchers, Amy Hewitt in this case will be doing most of the talking, to explain sort of the study, the findings, the implications, and then have a discussion after that. Okay, the research issue, and what we'll do is that I'll sort of just read through the sections of the relevant section of the brief, and then ask Amy Hewitt and Joe if he wants to chime in to talk about sort of the larger context behind the short summary in the PRB, and I'll be asking some questions too. So the research issue for this policy research brief was on direct support workforce and COVID-19. That was the survey that was used to generate these findings. But the brief itself is on focused on low wages and racial disparities that we observe in wages using the results of that survey. So this is during COVID times, but it's focused on low wages and racial disparities in wages. The research issue question is, there's a critical shortage of direct support professionals who support people with intellectual and developmental disabilities to live in the community. The national turnover rate for this workforce is 51%, and vacancies are 15 to 20%, depending on the position. And this is from the 2019 NCI Staff Stability Survey report. DSPs support people in a variety of areas, as we know, and their work involves a high level of skill. However, the high skilled and varied nature of this work is not reflected in DSPs' wages, which remain low. The overwhelming majority of DSPs are primary wage earners in their home. DSPs who choose to support people with IDD are predominantly women and are often people of color and recent immigrants. COVID-19 has shined a light on the importance of this workforce and the critical role they play in our community. People with IDD are at higher risk of getting infected with COVID-19 and dying of it. During the pandemic, many DSPs have been providing care to people with IDD who had COVID-19. This puts them at high risk every day. Yet less than a third received wage augmentations due to the pandemic. As our study showed, there may be racial disparities in hourly wage, household income, and additional hours worked. So Amy, this is a sort of brief summary, but can you, from your perspective, a perspective of the researcher who initiated this work, you and Joe, sort of the impetus for this work at the time that it occurred, can you set the larger context for how this work began?
Sure, Julie, happy to do that. I'm Amy Hewitt and I direct the Institute on Community Integration. Thanks for joining us today. And really, when COVID hit and we were all sent home to work, it was really clear to both Joe and I that the direct support workforce was going to be affected really in a significant way, because they were going to have to continue to work. The risks we knew that they were going to have because of the nature of their work was going to be very high for contracting COVID-19, supporting people who had COVID-19, and knowing what we knew about the workforce already, that the data you just shared about turnover rates, vacancy rates that have really plagued the industry since the inception of community supports, we knew that there was no way a pandemic was going to make those issues even worse. And so our thought really was to turn to the people in the workforce who we very rarely hear from. Most of the research that's done in this field related to the workforce is research that focuses on what their employers have to say or data that their employers have. So we wanted to turn to the actual workforce and ask them very briefly to share their experiences and observations during COVID-19. So that's sort of what I was thinking. Joe, do you have anything to add?
No, I just recall those early emails trying to capture what's happening in the lives of DSPs in real time when there was so much uncertainty and so much fear. And I think the first survey that we sent out, Amy, was put together quickly, and the responses were overwhelming. And I think, the first and the 6 month follow-up surveys, I think we had close to 10,000 DSPs complete them. So I believe that's the largest sample of DSPs to ever respond to a survey.
Yeah, we were happy with the response rate for sure.
Great. So with that, that's probably a good segue into some of the methods behind the study and the study background. I again will read that section of the PRB and ask some follow-up questions. For the vast majority of DSPs, staying home during the COVID-19 pandemic is not an option. NADSP and ICI staff wanted to hear directly from DSPs about their experiences in supporting people with disabilities during this period. In response, ICI developed an online survey and collaborated with NADSP to reach DSPs from across the country. Its intent is to inform effective policy and practice decisions about what is needed and to better prepare for potential future waves of this or other pandemics. The initial survey was launched in April 2020. That's the first wave that Joe mentioned, and was completed by 8,914 participants from across the country. A 6-month follow-up survey was launched in November 2020 and completed by almost 9,000 participants. And that's the current iteration, or the iteration that the current results are being drawn from. Data cited in this brief are from this 6-month follow-up survey. There's a link to the full report and the full findings in the PRB. There's much more information in that report than is in this brief, just FYI. This brief is just very select results from that report. So if you're interested in what else is in it, I do encourage you to go to this website. We'll send around the link later and read the full report. A 12-month follow-up survey will be fielded, and in fact is currently being fielded because it is June 2021, believe it or not. And it focuses on vaccinations, return to work, and social inclusion. Just to add a little bit in terms of the sampling and how the survey was conducted, this was an online survey, web only. There were 8,846 respondents from all 50 states. So this was across the countries. Some states had more respondents than others. In terms of demographics, because we will be talking about racial disparities, 73% of this sample was white, 17% was Black, and 5% self-identified as being 2 or more races. 7% self-identified as being Hispanic or Latino. So question to Amy, can you talk a little bit more, if you want to add anything more about the actual methods for the study, please do, but also anything that you want to know about the sample, differences, potential differences in demographics and how that might affect things, potential explanations.
Sure. So a couple things I'd add that you didn't mention, Julie, about the survey process. One was we did do an internal pilot of the initial survey and the 6-month survey, as well as an external pilot, and made revisions based on that, trying to target the stakeholders of interest to shape what the content of the findings would be in terms of the questions that we were asked. So that was an important piece. It's also really important to share that this is a convenient sample. As Julie, she did mention that it was an online survey. We pushed out the survey link to providers, to policymakers, to advocacy organizations in the intellectual and developmental disabilities field. So the sample reflects that. It reflects the DSPs that we were able to reach through, and also through social media, which was a big piece. And then lastly, a team of us at ICI and NADSP spent a lot of time personally connecting to people in the field that we knew, asking them to get the survey out to their direct support professionals or to their provider networks where direct support professionals were employed. So those are some important things. While a convenient sample isn't the same as a randomized controlled sample or even a stratified sample, the number of DSP respondents in this survey make it important for us to pay attention to the findings. 2 other things in the initial survey, because we really were trying desperately to keep the survey very short so it could easily be completed online and there were no complex questions in it, we opted not to include a demographic component. So our initial survey does not have demographic information in it. We have demographic information that was added to the 6-month survey, and it's also in the 12-month survey. So those are some important things that I can think of. Joe, is there anything else you'd like to add?
The only thing that I want to add on that is it's not as easy to reach direct support professionals as one might think. We really sent out hundreds and hundreds of emails to colleagues and partners across the country. And, DSPs are working a lot of hours and very busy people, and it's not as easy as one would think. And I was really thrilled by the returns here in the first 2 surveys that we sent out. And I'm hoping that even the last one is even going to be better.
Thanks. So Julie, when I think about what we found related to the demographic makeup of the near 9,000 DSPs that we talked to, I think about that as you said, it's important to think about it in the context of the United States, but also in the context of low wage and essential workers. So I was looking recently at a COVID-19 study that was done by the Brookings Institute. And one caveat is just to keep in mind as we're having our conversation today, that 50% of all essential workers in the United States are considered low-wage workers. And we know that DSPs are a low-wage workforce. That's been established decades ago. Of essential worker groups or categories of workers, the largest group are personal care assistants. And because we don't have a Bureau of Labor Statistics code, occupational code specifically for direct support professionals, they get kind of chopped up into a few labor categories or occupational categories, and PCA is the largest. So there's about 22.1 million PCAs in the United States. The median wage for those workers is $11.55. 23% are Black, African American, and 22% are Latino, Hispanic. So that gives you the context of the broader workforce that we're looking at, and disproportionately, the workforce is made up of people of color. So if you look at our sample, the percent of Black African Americans in our study was 17%. That compares to 19% in low wage essential workforce occupation across all occupational categories there. And 7% of our sample was Hispanic Latino, 22% of low wage essential workers are Hispanic. So that's the one area where, the one category where our sample is pretty significantly different than the general population of low wage essential workers.
And I will add, as a sort of having being a statistician by background, I will add that that caveat and the potential sort of difference in the percentage of non-white respondents does not, statistically speaking, does not throw shade or devalue the findings that we're about to show you in any way. So there's still, even though our sample, or this sample, is slightly more white than other studies have found, the difference is in terms of disparities between white DSPs and non-white DSPs that does not affect those, whether those differences are significant or not.
I think our challenge is figuring out how do we reach DSPs who are in that Hispanic Latino category and the providers that are employing them. We have to figure that out. We also have to think about ways in which we can distribute our research that is linguistically diverse. This survey was written in English and targeted to folks who use English as their primary language. So that's an area where we could modify our approach to getting a more representative sample that would reflect more closely the group of low-wage essential workers in the United States. That said, for most categories, or most populations, we were within the ballpark of the sample reflecting.
All right, well, so let's dive into the findings. This is the first key finding that is presented in this policy research brief. And this is a question that had to deal with wage augmentations due to being an essential worker and working during COVID. And sort of this general finding is that only about 30%, and this is regardless of the racial group. So this was about the same for each racial group, for DSPs in each racial group. Only about 30% reported that they got any kind of extra pay due to COVID-19 risks, which seems awfully low. Amy and Joe, can you guys talk about what this means exactly? Why so low?
Well, again, we didn't ask questions of the right people to answer that question. Why is this so low? It's not at all surprising to me. If you look at what happened to low-wage essential workers across all occupational categories in the United States, not all received any kind of essential worker pay. You can think of it in this way: the larger the corporation, the wealthier, the more prosperous the employer, the more likely workers were able to receive some sort of augmentation. There was some improvement from time one, our initial baseline survey, to the second survey, but it was very little growth in terms of the percentage of people who were getting some type of augmentative pay. If you think about where the money comes from and why this workforce is unjustly paid so low already, it's because we rely on elected officials at a local level to pass laws that increase rates, that increase pay for this workforce. So it's not like the providers that employ direct support professionals can just increase their rates and pay more, versus a target corporation can increase various costs for merchandise they sell to offset some of those costs. The other piece is that it took time for the United States Congress to pass relief packages and that to trickle down to states, and then from states to the workforce. And so my guess is in our 12-month survey, we might see some more modest growth, because in many states, eventually there was some type of augmentation for some workers in this field. But not all states chose to use it that way. And often it was more like a small bonus, not a wage increase. So I wasn't at all surprised by this. Joe, I don't know what your reaction is in terms of your interactions and work with direct support professionals.
So I wasn't surprised either. I think, as with many things, it comes down to the standard occupational classification. Direct support professionals are often an afterthought when things like this happen. We know who nurses are, we know who personal care attendants are, but when it comes to being deemed essential and eligible for extra pay that comes from government, and we have to advocate, don't forget about these direct support professionals. And, I've heard stories from DSPs recently who had to get a letter from their employer to carry with them when they drove to and from work, to make sure that if they got pulled over, they could show law enforcement that they were an essential worker. And this one guy was pulled over and he had to show this letter. And if you had an SOC, I think it's far less likely that you have to do that. So I think a lot of it is the anonymous nature of this work in the eyes of government.
Good time to talk about what that does for wages. So this is the next key finding presented in the PRB, and this is hourly wages. This was asked about hourly wages before the pandemic started. So this question really did not take into account any wage augmentations, if there were any, and it wasn't trying to measure what people are earning now. This was before the pandemic started. So clearly there are differences by race. The average hourly wage for Black and African American DSPs was $13.57 an hour, whereas for white DSPs, the average hourly wage was $13.98 an hour. Other DSPs, which include American Indian, Native Americans, Asians, we couldn't break those groups could not be broken out because they're too small. But the wage for DSPs in that group were $14.19 an hour. So I know that Amy and Joe, you already talked a little bit about it, but can you talk about just wages for DSPs in general and what you see in terms of differences by race? I'm curious also whether this kind of result has been shown before. Are you aware of?
Sure, Julie, I can take a stab at that. First, I wasn't surprised by this finding either. If you think about the context of wages and wage disparity and racism in the United States, we see disparities in wages when you compare Black African American workers to white workers. And so to think that it would be different in our industry because it's human services, I think is somewhat naive. So I wasn't at all surprised that there were disparities because these exist in every industry in our country. I will say that it is not very common that we have demographic data and wage data. I'm not aware of really having it on any kind of a large scale from the perspective from the actual workers. And it's very hard to get this data out of some organizations because they don't necessarily break down the demographic data to the granular level that we were trying to do in this survey. So I'm not surprised. I think it's something we can't ignore. And I think there are probably a lot of reasons that, and I'm looking forward to hearing from people on this webinar today about their thoughts for why those exist. Some things that I think about are, well, is there higher turnover amongst Black and African Americans, so they're not staying in organizations, they're moving? I don't know, that might be one plausible explanation. My guess is it's just rooted in ongoing issues of racial disparities in this country. Joe, your thoughts?
My thoughts, I mean, we've never seen this before. The staff stability report from the National Core Indicators does not address racial disparity in wages. This is the first time I've seen this. And, you know, wage disparity is real. And it exists in our service environment. The one thing that I just wanted to just bounce this back to Amy, it's also higher than the staff stability report data shows from last year, isn't it? For wages.
Slightly.
Yeah.
One thing that I think about, and Jillian, I saw your comment, in Minnesota, we've known that there's underutilization of home and community-based services by people of color for decades. And a recent study was just done of our service system that showed that Black and African American families and individuals are much more likely to use state plan Medicaid PCA services versus home and community-based waivered services. This sample of DSPs, most of them worked in waiver type funded programs. And so I think that one of the things that I think a lot about is, you know, funding streams guide services, and to what extent does this disparity exist related to type of service and where people of color are choosing to get services and then the staff they're choosing to provide support to them. So that's a really plausible explanation too.
Mm-hmm.
This is Department of Human Services. Can you hear me?
Yeah, Linda, we can hear you.
Okay. I've been having problems with audio on my computer, so that's why I'm asking. Just to let you know the numbers, this might be helpful. So 62% of recipients of PCA services are people of color, where I think it's more like under 10% are waiver service. People receiving services and waivers are mostly white, a large majority by far, but we don't have a way currently, DHS doesn't, of tracking the racial or ethnicity or language of the direct care workers in either of the programs. So that is problematic. So I'm just letting you know that that is a factor that it's hard to say.
Thanks, Linda.
Our next key finding is related to wages, and that is total household income, where we see that the inequities and disparities certainly persist. 59% of Black and African American DSPs reported their total household income to be under $40,000. 59%. And that's compared to 41% of white DSPs and 58% of other DSPs. So Amy and Joe, again to you, just talk about household income of DSPs, sort of what the household usually looks like, how many earners there usually are potentially, and just what you see in terms of differences by race for household income.
Sure. I mean, this data element isn't in the brief, but I think it's important to understand that the overwhelming majority of DSPs are primary wage earners in their home. And often the typical DSP family is a primary wage earner, a DSP, and a family of 3 people. So that's an important contextual piece, but it doesn't surprise me that non-white individuals were much more likely to live in a household with 40,000 or less income, because they are also more likely to be primary wage earners in their home. And if you're the primary wage earner in your home and you're working as a direct support professional, you are making right at poverty level wages if you have 2 kids.
Yeah, and to compound that even more, 83% of the respondents are women, and that is, you know, many of them that we know anecdotally are single moms. So getting back to the original purpose of the policy research brief here, I mean, we've used your research to try to affect public policy for decades. I think this information is key to use to change public policy in the future. I mean, we've got the research, we've got the data. This is compelling. And I think advocacy organizations need to use this because it's pretty clear there is such racial disparity here in our workforce.
So talk about what that does, the low wages, the income, the fact that so many people are sole earners in their household. Talk about what that does in terms of additional hours worked, because the next key finding is about how many people work at least 16 additional hours per week. So this is overtime, right? How much overtime do people have to work? And 43% of Black and African American DSPs said that they have to work at least 16 hours, additional hours a week or more. That's compared to 26% of white DSPs who said that, and 32% of white DSPs. So Amy.
Sure. So one piece is if your household income is below 40,000 and you're a primary wage earner, you're probably more likely to work overtime. So that makes some logical sense to me. But when I look at these overtime, the percent of workers having at least 16 hours or more of overtime. One, it's very high. Overtime leads to stress and burnout. Stress and burnout leads to issues related to quality of the type of services that somebody's supporting. So we, for a long time, this industry relies on this use of overtime, and workers who are working overtime in one organization and then maybe also working part-time in another organization. And that to me is, I don't talk about this workforce being in a crisis because I don't know how you compound crisis over crisis over crisis for 30 years. You can't. It's structural and systemic challenges. And in my mind, this is a predominantly female workforce that is disproportionately compared to US population. People of color, they're low wage earners, and it's just flat out structural oppression. And we don't, that's very bold for me to say, but it is what it is. And you can look at any other female dominated professions, and the way in which they kind of moved to being becoming more respected, earning greater wages, having better access to benefits, more focus on health and wellness opportunities is through licensure, credentialing, naming the skills and competencies that the workers need to have. And that just hasn't happened in this industry. So I'm not surprised by the overtime hours and how much workers are making, and the cost of that to the system. Overtime is very costly to any organization. I just worked with one organization, and I think it was something like $600 and some thousand a year. It was costing them in just the extra halftime they were paying in overtime.
Amy should drop the microphone right now. I think you nailed it, and I think the most recent data that I saw on the cost of turnover is $2.4 billion nationally in overtime, and it's unsustainable. And we're starting through our eBadge Academy. We're working on a report, and we're seeing how certified direct support professionals turnover significantly less. Now, there could be a lot of reasons for that. I'd love to talk about that further, but overtime, DSPs rely on it, sadly, and the effect that it has on mental health, the effect that it has on the quality of supports is just year after year after year. It's never gotten better. $2.4 billion.
Pretty scary.
Yeah.
So when the DSP wages that you first put on there between, that slide, was overtime factored in to that wage? Okay, I'm just wondering, because I was like, wow, then it's an even huger disparity, right? So, okay, that was my question. Thank you.
Right. So finally, just to get us moving into the discussion. So finally, the research brief has some policy recommendations. Again, very, very short. Every brief will have them. I will read through them and then we can discuss. It is critical that systemic challenges of high turnover, high vacancies, low wages, disparities in wages among racial groups, and the effects that these challenges have on the lives of people with intellectual and developmental disabilities be addressed through significant policy change. This includes official identification of DSPs as essential workers. That's what Joe was talking about. Access to essential worker status and pay may give DSPs childcare and financial support needed to remain in their jobs. Professional recognition, also what Joe was talking about, and wage equity for DSPs. They have always provided critical, essential supports for the millions of Americans with disabilities. The low average wage of DSPs is not reflective of the skilled nature and varied responsibilities of their work. Equity issues identified for Black and African American DSPs with regard to wages must be explored and resolved. The wage differences between Black African American participants and white and other participants, and the reality that they were also more likely to be the primary wage earner in their household and had lower household incomes, likely contributes to their need to work more hours, which is what we talked through. So to Amy and Joe, and then we'll just discuss all together. Can you talk more about what you think might or must or could be done, especially in the the current political research and policy climate? Do you see any opportunities? For this work, but then also for the issues. Does this present us with an opportunity to make a difference somehow?
So my initial reaction to that question, Julie, is these issues already existed and they've existed for a long time. COVID-19 really accelerated how communities across this country saw and identified essential workers. If you reflect, it took a while for this workforce to even be identified as an essential worker. In our baseline study and in the 6-month follow-up, 97% of this workforce identifies themselves as essential workers. We looked at state definitions of essential workers at the time of our baseline study, and only 17 states actually had any kind of description in their definitions of who essential workers were that touched on home and community-based services, direct support professionals. They just were omitted, and it took a while. As Joe shared some examples of that, it just took a while for them to even be identified as essential workers. So there's a long history of really challenging issues in this field. COVID-19 brought highlight to them. This study just brings more data to talk about the same issues. There aren't enough workers, but now that's in the context of post-COVID in the United States. And there's not an employer anywhere that's not struggling to find employees right now. And so you've got this industry that relies on federal and state dollars to pay for it and doesn't have the ability to just, okay, yes, we want to raise our wages to $20 an hour. That takes political will at a state level, at a legislative level, in each and every state to make it happen. So I think COVID-19 and some of the policies that are coming from already have been passed and are being talked about at a federal level provide some opportunity. So I'll pass that to Joe.
Yeah. Thank you. I agree. There's very high level discussions, and it always comes back to workforce. I was on a call yesterday, and they're talking about the $400 billion that is, proposed to go into the system and to expand HCBS. It cannot be expanded without addressing the workforce issues. And that needs to be the #1 priority. And I heard Amy say once, and I learned so much from Amy, at the end of this pandemic, with all of the data that we have before us and all of the anecdotal information that we have from DSPs, if we don't do something now, It's just exploitation of this workforce. And those are Amy's words. And I'm using them now, Amy, and I give you credit for it because it is absolutely true. It is exploiting this workforce, which is predominantly a workforce of women and women of color. And it's a social justice issue, in my opinion. It is clearly a social justice issue. So I think that these policy recommendations are sound. And again, I come back, I sound like a broken record. It's going to come back to that professional identity. We need a professional identity through the SOC. That's step one.
And Joe, I would clarify that when I say it's exploitation, I'm not saying that providers are exploiting DSPs. I'm saying society, our culture is exploiting DSPs.
Absolutely. I hear you loud and clear.
All right, thank you. So with that, we would actually like to spend the rest of, we have more than half an hour, so we could spend a whole half an hour talking. If this generates a good discussion, people want to do that. But here are some questions for discussion, and we'll just open up to whoever wants to chime in on any of those questions. What are some of the potential drivers, explanations of racial disparities in DSP wages that we saw? How can we leverage recently passed legislation to address low DSP wages and these disparities? And also, how can we shape future legislation to address low DSP wages and disparities? So we'll just open it up to whoever wants to chime in, if anybody. Any thoughts? Potential drivers, explanations of what we saw. Amy listed a few.
This is Sherry. I think one of the drivers here, racial disparities in DSP wages, has to do with a devalued population, a devalued group of workers serving a devalued population, and so it's the what is it called, the intersectionality. It's a double whammy because people with disabilities themselves are devalued, and so I think that's very relevant to this discussion. It's interesting to me, not a surprise though, about the difference between the kind of services that people get depending on their race. I hadn't heard before that individuals with disabilities who are white are more likely to get waiver services, and individuals who with disabilities who are Black are more likely to get state plan services, and that I think there's a lot of room for additional research around why that is, whether that is similar across states. There's all kinds of questions that I have around that.
Anybody else wants to chime in? Do we have folks on the call who know much about and can explain potentially in terms of the legislation that has been passed, how that affects the issues that we're talking about, how that can be leveraged?
Julie, one thing I do know is that a lot of states are trying to use some of the COVID money that's came to them to address the workforce issues. The challenge is this is not money that's going to stay forever, right? So you can make a decision to use that money to increase wages, but then how are you going to pay for them ongoing? Because the supplement money that came to states isn't there to stay. And so some states have done things like for lack of a better words, a bonus or a supplemental amount of money that you might get to your budget or to DSP wages. Now some states are are really looking at how can they systemically address it. So at least trying to build some infrastructure and to begin to have coalitions within states of the kind of disability services, whether that's Department of Health or Department of Human Services, wherever it comes in a state, connecting to education and labor to try to create comprehensive programs for pipeline, as well as training and education. Many are talking about credentialing. The challenge is you have to be able to get the local appropriation for any kind of ongoing pieces. So
this might,
it's helping. I agree with Joe that I get very nervous with some of the, it's talked about potential legislation that's going to rapidly open up waivered services and grow waivered services, because without simultaneous, serious structural change, workforce challenges, a third of providers in this country are turning down. They can't offer more services to people who actually have it authorized. So adding more and more people who need services to that, I think, is not helpful.
this might be a silly question, but does anybody know what proportion, if any, of the DSP workforce is unionized?
It's very small in the IDD field. The last numbers that I knew, it was under 10%. The workforce within this sector, if you look across PCA, direct support professionals, home health aides, CNAs, unions are more likely to represent direct support professionals who are independent contractors in states on state plan services.
Others thoughts of where we go from here? It's clear that there's an issue. What can we do about it? Brainstorming session.
This is Jillian. I'm with the Autism Society of Minnesota. I have lots of thoughts. I'm an autistic adult. I'm a consumer of direct support professionals, and I also work as a direct support professional. What my client needs is things I can do, and what I need are things that my professionals can do for me. So it's a really unique dynamic. But I think when we start talking about the wage disparities and all of this stuff within the direct support professional field, we also have to look at the systemic racism and how services are being divided within our organizations. We typically see the highest driven wage increases. Like, we've seen increases for wages for direct support professionals that are being paid under waivers. We've routinely seen those over the years at a much larger percentage than we have wages for individuals who are receiving direct support services through straight Medicaid. And for the rest of this explanation, I'm just going to refer to them as PCAs and direct support professionals, because it's so much easier than explaining where they come from. So PCA wages are driven by union contracts and Medicaid reimbursement, and we see that at a much lower rate, but we're also not seeing the same level of advocacy outside of like the union or some consumers of PCA services advocating for those increased wages. However, individuals that are receiving waiver services, we see a lot more advocacy on Capitol Hill for things like waiver increases, for things like DSP wage increases, for things like TEFRA reductions. And I think a lot of that comes along with the privilege of who's utilizing those services. Typically, our direct support, our PCA service users and our PCA service workers, they, with that lower income wage, with that heavier reliance on immigrant communities and people of color, we don't always have that same social capital to show up at the Capitol and say, I need a higher wage as a PCA, or I need I need my PCAs to have higher wages. Where when we see the waiver services are improportionately distributed to families, upper class or middle class to upper class families who are white, a lot of times those DSPs, especially because a lot of those DSPs are accessing paid parent services. So this has now become their job. They have the social capital, the means, and the time to show up at the Capitol and advocate those things. And that's why we see such a drastic disparity where like the mean wage right now for a PCA, in fact, the federal guideline, the wage that is in our contract right now is $13.25 for a PCA. However, a DSP can make over $17 an hour. Why is there a $4 an hour difference? And when we start looking at where those services are going, I think if we really start moving to end the systemic racism and the systemic ableism that exists within these services, we're going to be able to close those wage gaps. And I would be drastically curious to see like some of this data to know who actually responded to these surveys, like seeing those disproportionate numbers. And what I know from being a union member, our PCA community is not a predominantly white workforce, yet we had a predominantly white response. And that really says something. And I think research like this, we also need to look at accessibility and how is the research feeding into the systemic racism and the systemic ableism that has caused these divides within our community and has caused to continue to like, I mean, basically these wage increases continue to perpetuate poverty systems for both people with disabilities and people of color. And until we address those greater things, we're going to continue to see these trends. I have things to say about this.
Julian, I one of the things that you said I wanted to pick up on, I think that this survey illustrates the success and power of the NADSP, of kind of the network that it's built. I think one of the challenges is if the interest is in reaching workers who are especially Latino or Latinx, it might require a shift in how we talk about it, because it's not just probably the Medicaid system that is different, but it's also it's related to who gets connected to NADSP, what kind of services do those providers offer compared, I mean, and so it might require, if we really want to be serious about reaching workers who are diverse, it may require changes, not just legislatively, not just structurally for service providers, but also in terms of how we think about the advocacy efforts that we're doing.
Oh, 1000%. I mean, and that's a big piece. Like if we're gonna find equity in DSP workers and wages for PCs and DSP workers, we also need to look at how do we find equity within the disability community? How do we bring communities that have traditionally had a very different mindset about disability into sharing the same philosophy that organizations like ICI and the Autism Society and other disability organizations share, where that disability isn't something to be ashamed of, it isn't something to hide, it isn't something to be embarrassed of. Like we still, in bringing other communities in and closing those social capital gaps, we have a lot of work on cultural understandings of what disability means. And I think when we have things like this and we start reaching out to our personal networks and saying, hey, can you take this survey? We look at those personal networks and the education and advocacy programs that exist within the disability community still have a lot of racial disparity as well. So when we start utilizing our social networks and our professional networks to distribute it, we are missing a lot of workers because those networks, those social capital networks aren't necessarily the most inclusive or most diverse, despite many, many efforts from many, many organizations to change that and improve that. We still have more work to do and to figure out how to meet, how to get information from the people that aren't necessarily in those same things. Like I personally, I have a staff of 4 PCAs that work for me. Every single one of my staff are either queer, neurodiverse, or people of color. Not a single one of my staff I've texted all of them. Not a single one of my staff heard of this survey or responded to this survey. That's a very different experience than I'm sure if I actually texted my social group, who a large portion of them are paid parents, I would probably get a very different response. So my question was, was this survey sent out to agencies as well? Like PCA agencies that are managing, like did MCIL like MCIL is my service provider. Was this sent to them and asked to be distributed to their employers or employees?
It was.
That's interesting because my employees didn't see it.
Yeah, so it can be sent, but that doesn't necessarily mean it's going to be distributed.
Yeah.
You know? That's our challenge, is that it's difficult to reach DSPs.
And I think that is also some of the place that we do see some of this disparity in wages and wage increases and shaping future legislation, is that there does end up being some headbutting between those that want to see wages increase for DSPs and agencies. Because if we are not doing the work hand in hand of increasing wages for DSPs and increasing the reimbursement structure, then we're not going to see employers of DSPs want to go along. Like, I know that the new PCA contract that we're trying to ratify during special session, there are many, many agencies that are concerned if they do not increase the wages, it's going to close doors for everything other than the largest of the large organizations, because that wage increase without a reimbursement increase they won't be able to support running the business. Does that make sense? So I think unifying those wage increases with those structural increases would really help shape future legislation on how we increase wages, because then we're not going to have businesses coming to the table about wage increases saying, but hey, we need this. If we can have that unified front, if those asks are unified instead of separate.
Thank you, Julie. Others want to chime in? All right. Well, while you're thinking, I do want to say sort of one thing going forward. We are going to try to do these every few months. So a new policy research brief and associated policy forum to go with it. We are hoping that future policy forums will generate sort of ideas for moving ahead. This is all going to be stakeholder driven. So if you have ideas or thoughts or requests potentially in terms of what the next or an issue of a PRB should be focused on, please drop us a line. If you have any follow-up thoughts about this discussion today, please drop us a line as well. This is mine and Amy Hewitt's emails. You can email either one of us. Also, if you have thoughts about just in general, what you thought sort of about this format of the brief itself and or of the way that we're structuring the policy forums, sort of presenting the results, let us know if you think this is good, this is not good, if this is effective. The two-pager brief, really, the idea is really that you can take it and stick it in the face of your legislator somewhere before they run away. And because it is so sort of focused and simple, there's not an excuse not to at least glance at it. So please use these and give us, and we're looking for ideas on how to make these more useful and just improve the utility of them as much as possible. So Amy, is there anything you want to add at this point?
Just send us your ideas for topics. We do a lot of research at ICI, and we can pull these briefs together on varied topics. I think you can expect several more coming out in the next 12 months related to the DSP workforce because of this research, but also the 12-month follow-up.
but there will be other future issues on other topics as well. So please send them our way. All right. With that, we can, unless others have had thoughts that they would like to make to voice, we can call this a successful first policy forum.
I do have a question though. With these policy forums, what is ICI's goal for supporting the broader disability policy community?
Amy, I'm gonna pass it to you.
Sure. Our research, Jillian, is primarily, but not solely, focused on intellectual and developmental disabilities. Some of our research will cover the broader disability group. I think what we're trying to do is, as Julie pointed out, is a lot of times we engage with just the developmental disability community. And what we're trying to do with these policy forums are to say, okay, here's what's going on in developmental disabilities and how does that connect to the broader disability community, but then the broader, in this case, workforce, low-wage workers, essential workers. So what we're trying to do is bring the issues that are identified, experienced, researched in IDD to a broader audience to make those policy connections, because those very broad collaborations are essential in the policy advocacy aspects.
Oh yeah, I asked like, I'm run the policy for, well, I co-chair the policy work at the Autism Society. And like a lot of times having research and stuff, like we're working on an 8-bill accessibility package right now that completely redefines accessibility from an IDD, neurological and sensory standpoint. Because right now all of Minnesota's guidance is focused on physical access. So having groups like ICI at the table with us saying, hey, here's the research we did and everything they're asking for is research supported would be so gigantic for us being able to get things moving forward. And not just be like, yeah, but I need more than a ramp. And I need you to just listen to my life story to understand that a ramp doesn't equal full accessibility.
And Jillian,
ramps are also important, though, for the record. Ramps are also important.
Yes. Our challenge is getting the research we do in an accessible format that's useful to people who are in roles like you. And that's what we're trying to do.
Awesome. I also fully submitted my current policy agenda as a potential LEND project.
Oh, good.
Send me your fellows.
Great, thanks.
I am a Department 1 and a volunteer. I need all the help I can get.
All right. Thank you everyone for participating. I think we can call this a meeting. Have a good rest of your day. We will send slides and links to the reports after this, and then please look out for an announcement for the next one.